I'm often asked by patients when I've told them about their eye drops and we've got that all sorted out, what else can I do to help with my glaucoma? Is there something I should be eating? Is there something I shouldn't be doing? So that's what I'm going to try and address today. However, you mustn't forget that the most important thing is bringing the eye pressure down, which for most people means using your eye drops. Never forget them. If you miss a day, your eye pressure will go up and there'll be a bit more damage. You've got to make sure that you can get your eye drops in your eyes, and this may mean you need someone to help you. The technique of punctal occlusion is really useful. That means that the drop really soaks into your eye. Get your eye doctor to show you how to do this. You do need to keep seeing your eye doctor, your clinician. You don't know if your glaucoma is controlled or not, and it's only through regular visits that we can be sure that the pressure's right and the glaucoma is not getting worse. Most people with glaucoma have what we call primary glaucoma. In other words, it's not due to something else. Primary glaucoma is not something we catch, and it's not due to lifestyle, it's due to our genes, the genes that we got from both our parents. I think this is quite important to remember. Having said that, diet and lifestyle choices may well help with glaucoma. They can alter the pressure in the eye. They can alter the blood flow to the optic nerve, which we believe is very important in glaucoma. And they can also alter apoptosis, which is the process whereby you lose nerve fibers in glaucoma. There are many studies, but most of them are just soft evidence, and big studies have often failed to reproduce the results of smaller studies. And this makes this whole area a bit of a minefield. I don't like giving advice if I don't have evidence for what I'm saying. And some of the things I'm talking about, the evidence is, fairly soft. However, I think there's pretty good evidence for a number of factors that I'm going to mention, and I'll put a red star by these so you'll know which ones they are. So, there are a number of things in the way we lead our lives that can make your eye pressure go up. And obviously, if you've got significant glaucoma, this can be a bad thing. We talk about the Valsalva maneuver, which is holding your breath whilst exerting, which is what we all do when we move our bowels, but people also do it at other times. For instance, playing wind instruments, particularly brass instruments. In yoga, if your head is below your heart, your eye pressure will increase. And in some yoga positions, people will maintain this for quite some time. And that may be significant if you've got serious glaucoma. There's some evidence that even a tight necktie can push the eye pressure up. Lifting weights is an important one. If you want to build up your muscles, it's much better to do repetitive maneuvers with lower weights than trying to lift really high weights, because that pushes your eye pressure really high. Drinking coffee pushes your eye pressure up. I think there's a real case to be made for just watching how much coffee you drink during the day. We know that if you drink a large amount of fluid in a short period of time, that will definitely push your eye pressure up. And we sometimes do this in the clinic as a test. Many people know that marijuana brings eye pressure down, but we don't recommend its use. It brings eye pressure down for a period, but we want your eye pressure to be down 24 hours a day, 7 days a week. And I don't think being permanently stoned is really something we should be recommending for a variety of reasons. Quite an interesting idea is sleeping with your head up a bit. This is the opposite of having your head below your heart. Sometimes people put bricks under the end of the bed or just have lots of pillows. And this may well be something that you should think about if your glaucoma is progressing despite using your drops and doing everything your doctors said. Exercise lowers eye pressure, and this is proportional to how much exercise you're doing. And this is quite significant again. In one study, glaucoma patients dropped almost 5 millimeters, which is a lot after a period of aerobic training. And this persisted for several weeks, even after they stopped the exercise program. There are many reasons to undergo exercise, and helping your glaucoma is another one. People often want to know what they should eat, and there's some soft evidence that I've put up on the screen here that certain dietary choices can be helpful. Fortunately, there are lots of other reasons to be eating this sort of diet. In general, this is the sort of diet that we believe these days is good for your heart and for preventing strokes and for all sorts of other things. The evidence is pretty mixed about whether obesity is an issue for glaucoma. Equally, there's been some suggestions that smoking is a bad idea for glaucoma, but generally that hasn't come up. But there are lots of other reasons for your general health not to be overweight and not to smoke. So what about nutritional supplements? Fortunately for me, a major review was published last year in the Survey of Ophthalmology, which is a very reputable ophthalmic journal, and they looked at a large number of trials. Some nutritional agents were shown to bring pressure down and others to preserve visual field. And we know there's a lot more to glaucoma than just bringing pressure down. And really, we've been looking for a long time for drugs or agents that will help glaucoma and through other mechanisms. Again, the quality of these different trials vary hugely, but there is some pretty good evidence for a number of nutritional supplements. The strongest evidence is for Ginkgo, and this is the Ginkgo, beautiful Ginkgo tree in autumn. So Ginkgo has long been used in Chinese traditional medicine for dementia, for circulatory problems, and for a variety of other things. As I said, there are 4 studies in humans, but there's some very good evidence from laboratory studies and animal studies that Ginkgo does just the sorts of things we want to see in glaucoma: improving blood flow, neuroprotection. It's an antioxidant and anti-inflammatory. Ginkgo is very safe. The only issue really is that if you're on a blood thinning medication, you may have an increased bleeding risk. And if you're coming up for surgery, it's always worth mentioning you're on Ginkgo. Forskolin apparently is from an Indian plant called Celeus forskoli. And again, this is a traditional Indian herbal medicine. One of the reasons why this sounds more promising is that it has been shown to have biochemical actions that make sense in our understanding of glaucoma and physiology. And so there are theoretical reasons why it could be helpful in glaucoma. Another long-term nutritional supplement is Peaa, which comes from soybeans and egg yolk. And this has long been used for chronic pain and inflammation. And there is some evidence it's helpful in glaucoma also. Anthocyanins are the dark red, purple, blue, black pigments found in berries, grapes, black rice, eggplants. And the trials have used extracts from bilberry and from black currants. And these have been marketed for decades, and we have traditionally said there's absolutely no evidence that they do anything. Well, we have to change what we say, because now there is some evidence. There are a couple of fairly recent trials that have shown some benefit. Finally, there's this Chinese daisy, Erigeron brevis carpus, another traditional Chinese medicine. And again, if it's helpful for ischemia and neuroprotection, these are the sorts of drugs or aids that could well be helpful in glaucoma. So what do I recommend to you? I certainly recommend exercise, and I think we should all try and lead a healthy life, watch our diet, eat fish, not be overweight. I think you should realise that if you do drink a large amount of fluid in a short period of time, that will push your eye pressure up, and it's reasonably easy just to be careful not to do that. I think we should think about sleeping with your head raised, and in particular, if the doctor's having trouble controlling your glaucoma and it seems to be progressing despite having good pressures in the clinic. There's certainly evidence that excessive coffee intake is not helpful. I haven't really talked about blood pressure, but this is actually quite important. You don't want your blood pressure to be too high, but equally you don't want it to be too low, particularly at night. I think you need to think very seriously if you are into lifting heavy weights and you have serious glaucoma. Likewise, prolonged playing of wind instruments. Think about how you do your yoga and don't tie your necktie too tight. I think there's a good case for thinking about taking nutritional supplements. The best evidence is for Ginkgo, and there's the list of the 5 I've mentioned. I have no commercial interests, unfortunately. I tried to find out what's available in New Zealand. Clinicians' OptiSite really seems to be the best option because it's got 2 of the supplements I mentioned, Ginkgo and blackcurrant. There is a Blackmore's bilberry product. Otherwise, I found it pretty hard in my limited research to find the other agents I've mentioned, but it's amazing, of course, what you can do online, and there's no shortage of health shops to visit. So I hope that is helpful if you're wondering, how can I give my glaucoma the very best of care? And I think a lot of those things I've suggested are quite doable. Thank you.